Hello, and welcome to the introduction of the IAMAW Humana Group Medicare Advantage Plan. This plan was specifically designed by the IAMAW and is exclusively offered to their retirees, spouses, and eligible dependents. We are so happy you decided to take a few minutes out of your day to learn about everything this IAMAW group plan has to offer. Today, we will cover everything you need to know, including who is eligible, details of your medical and prescription drug benefits, what doctors you can use, and how you can enroll. But before we get started, we would like to take a moment to tell you a little bit about Humana. We may be a new name to you, but we are not new in the industry. Humana began as a nursing home assisting older adults in 1961, and now we have 8.8 million Medicare members across the United States. We have provided Medicare Advantage plans for over 30 years and offer an extensive network of providers across the nation. Medicare Advantage is what we do, and we are excited to share our expertise with IAMAW and their retirees. Now we'll talk about the plan itself. Who is eligible? What is my plan? And how does it work? Like we mentioned before, this group Medicare plan was specifically designed by IAMAW. Because of this, it is exclusively available to all IAMAW Medicare eligible retirees, their spouses, surviving spouses, and Medicare eligible dependents. Individuals must also be eligible for and enrolled in Medicare Parts A and B. Most people qualify for Part A at no cost, but Part B does have a monthly premium that you must continue to pay. Finally, you must reside within the United States or Puerto Rico in order to enroll. The IAMAW Humana Group Plan is a group Medicare Advantage plan which combines your Medicare medical and prescription drug benefits within a single plan offering. Your Humana IAMAW Group ID card is the only ID card you will have to carry with you. Whether you visit a doctor, hospital, or pharmacy, this is the only card you will have to present. You will not need to show your red, white, and blue Medicare card, and you will not have any cost sharing through Original Medicare. With every Humana Medicare Advantage plan, you will have no copays for preventive care. You will have an out-of-pocket maximum that limits your potential financial exposure, and you will have worldwide emergency coverage if you travel outside of the country. All Medicare Advantage plans are governed by Medicare and must follow Medicare guidelines. Any service or procedure that is covered by Medicare is covered by this plan. One of the best features of this program is Humana's passive PPO network. This means you will have the same level of benefits at any provider nationwide who accepts Medicare and is willing to submit the claim to Humana, regardless of whether the provider is considered in or out of network. We understand that having a choice of doctors is important, and this plan gives you great flexibility in who provides your care. You can use any doctor, network or non-network, without a referral as long as they accept Medicare and will bill Humana. The IAMAW Humana Group Plan covers all medical services otherwise covered under Parts A and B of Original Medicare. This includes doctors, hospitals, medical supplies, etc. Your group plan has no annual deductible and also features a $0 copayment for primary care visits. Whether you are sick or seeking preventive care, you will have no out-of-pocket costs when receiving covered services from your primary care physician. If you are admitted to the hospital, you will have only a $195 copayment per day for days 1 through 5. If you are in the hospital longer than 5 days, Humana will pay 100% for days 6 and beyond. The annual maximum out-of-pocket for this group plan is only $4,500. This is a per-person limit on how much you could have to pay for covered medical services in a calendar year. Humana tracks your out-of-pocket cost, and if that reaches $4,500, Humana will pay 100% of covered services for the remainder of the year. There is also no lifetime maximum benefit, which means Humana will pay indefinitely on your behalf for covered services. Your IAMAW group plan also includes an additional benefit of $250 dental allowance per year. This is a benefit not included in Original Medicare and will cover preventive dental benefits, including bite weighing x-rays, fluoride treatment, and up to 2 cleanings per year. Please be sure to refer to your enrollment kit for full benefit information. Your IAMAW group plan also includes prescription drug coverage. Humana's Part D coverage is broken down into 4 groupings based on the drug type, also called tiers. This plan has an open formulary, meaning it covers every drug that is covered through Medicare. Tier 1 is comprised of generic medications. Tier 2 contains preferred brand name drugs, while Tier 3 includes non-preferred brand name drugs. In Tier 4, you will find specialty medications. The member's cost share for a medication is determined by which tier the drug is in and where you fill your prescription. For a 30-day supply filled at a retail pharmacy like CVS, Walgreens, or your local drugstore, you will pay only $5 for Tier 1, $30 for Tier 2, $60 for Tier 3, and 25% of the cost of the drug for Tier 4. For maintenance medications, you can receive a 90-day supply through Humana Pharmacy mail order. Your cost for a 90-day supply via mail order is $0 for Tier 1, $60 for Tier 2, and $120 for Tier 3. Tier 4 prescriptions are limited to 30 days at a time. Using Humana Pharmacy mail order is the most cost-effective way to receive your medications, especially considering that you do not have to pay anything for Tier 1 generic drugs. As you can see, our IAMAW Group Medicare plan through Humana will allow you to use Humana's 90-day mail order and receive 3 months prescriptions for the price of 2, essentially saving an entire month's copay on your prescription cost in Tiers 2 and 3. On this slide, you see the different standard drug stages for Medicare Part D plans. The first stage is the deductible stage. Your IAMAW plan has been designed to have no deductible for prescription drug coverage. That means you will start the plan year in Stage 2, the initial coverage stage, where you will pay the co-payments detailed on the previous page. If the total cost of your medications reaches $4,020 in 2020, you will be in Stage 3, which is known as the coverage gap or donut hole. In this stage, you would continue to pay $5 for generics, but IAMAW group members will only be responsible for 20% coinsurance for all other medications, regardless of the tier. This coverage through your IAMAW group plan is enhanced to provide you with a lower out-of-pocket cost than the standard Part D benefit. If your out-of-pocket cost reaches $6,350 in 2020, you enter Stage 4, which is the catastrophic stage. In this stage, you will pay the greater of $3.60 for generics, $8.95 for all others, or 5% of the cost of the drug. Humana will track your progress through these phases and will communicate that information to you via a monthly statement. Now let's talk about the extra benefits and resources included in your plan. Silver Sneakers is Humana's free gym membership available to you at participating Silver Sneakers gyms. You can use in-network gyms close to home and even when you are traveling. You are not tied to one gym and would simply show your Silver Sneakers or Humana ID card at participating gyms to utilize Silver Sneakers classes and/or equipment. Go365 is Humana's reward program. Go365 will help you track and monitor your progress toward your personal health and well-being goals. You can earn Go365 by participating in Silver Sneakers classes, receiving certain preventive services, and attending social events. Humana Well Dine is another benefit included in your plan. You would qualify for this benefit after an inpatient stay in a hospital or skilled nursing facility. This program will provide you with 10 nutritious pre-cooked frozen meals delivered right to your door at no cost to you. Different meal options are offered, such as diabetic and vegetarian. You may be wondering how much all of this will cost. Your plan's monthly premium is only $84 per person. This premium is fixed through the end of the year 2021 plan year. We have covered many different topics and want to re-emphasize some of the most beneficial aspects of your IAMAW Group Humana plan. Your plan is a passive PPO, meaning members may visit any provider that accepts Medicare and agrees to Humana's terms and conditions. This plan also has an open formulary, meaning it covers any drug covered by Medicare. There are no medical or prescription deductibles. There is a $0 primary care copayment. There is a $0 copayment for generic prescriptions filled by Humana Pharmacy. There is also a $250 preventive dental allowance, which is a benefit not offered by original Medicare. Let's discuss enrollment into the plan. When can you enroll? How do you enroll? For individuals turning 65 in 2020, you will receive an announcement letter and enrollment kit approximately 90 days before you turn 65. You can enroll in this plan as of May 1st, 2020, or your Medicare effective date, whichever is later. Most individuals are eligible for Medicare on the first day of the month in which they turn 65. For individuals who are already eligible for Medicare, you will receive an announcement letter and enrollment kit in September. You can enroll in this plan beginning October 1st, 2020 for a January 1st, 2021 effective date. How do you enroll? There are two ways for you to enroll in your IAMAW Group Medicare plan through Humana. The first way is to complete a paper application. Your enrollment kit will include an application which may be completed and mailed back to Humana via the included addressed envelope. Another option you have is to call the Humana enrollment team at 1-800-833-2411 to enroll telephonically with a licensed agent. Again, please do not hesitate to call our enrollment team at 1-800-833-2411 if you have a question about the plan. Our team can review benefits, provide prescription drug cost information, and send you an enrollment kit, and of course, help you enroll in this group plan. We'd like to thank you for taking time to listen to the IAMAW Humana Group Medicare Advantage Plan presentation. We look forward to hearing from you and supporting you on your healthcare journey.